My name is Jaleesa Brown, and I'm a urologist. I work at a hospital as well as a private clinic. Some patients may need treating related to their bladder, urethra, ureters, kidneys, and adrenal glands, just to name a few. I have seen many patients over the years dealing with kidney and or bladder stones, which is what I would like to focus on in this presentation. Treatment depends on the type of stone, how bad it is, and the length of time you've had the symptoms. Often you can simply wait for a stone to pass. Smaller stones are more likely to pass on their own than larger stones. Larger stones would need to be removed surgically. Some symptoms of kidney or bladder stones include pain areas in the back or side part of the body, as well as severe, sharp, or sudden pain in the abdomen. You can also have pain occur during urination, blood in urine, and frequent nausea or vomiting. Sweating is common as well. I often see between 15 to 30 patients a month with kidney or bladder related issues. I have prescribed many different medications for kidney bladder stone disorder. Here are some common ones that I have prescribed. Urinary retention medicine. This helps improve urine flow. Tamsulosin is one of the common drugs given to help with that. A narcotic that I might give to help with pain related to the disorder is morphine sulfate. Non-steroidal anti-inflammatory drugs, which can relieve pain, decrease inflammation, and reduce fever. Some health behavioral changes that I suggest to my patients are to make sure they drink plenty of water and to watch their diet, especially if the patient is coming in more than often with this disorder. One of the goals of kidney and bladder stone treatment is to keep your urine as dilute as possible. This helps to keep this helps to keep the substance that could potentially form a kidney or bladder, such as calcium and oxalate, move quickly through the urinary tract. On average, what determines the nature and duration of treatment really depends on the patient. For example, a patient can have either a bladder or a kidney stone for the first time. They come in and I can prescribe them medicine for pain and they can pass the stone at home if small enough. And that's it. There are times when the symptoms can be severe, where I would need to do further testing or have surgical procedures done to have the stones removed. Like I mentioned above, a symptom can be urine in the blood. In that case, we would have to figure out exactly the cause for the blood in the urine and if anything else is causing that issue. I have a patient who I'm currently treating for bladder stones. She is a Caucasian female, 26, and a surgical technician. Her previous medical issues include history of chronic pyelonephritis, fibromyalgia, and migraines. My patient came into the office with pain in her lower flank, abdominal bloating, dysuria, and hematuria was present as well. We then decided to do a CT scan with and without contrast and a urinalysis test. Some minerals were present in her urine sample. Calcium and oxalate were the minerals found. As you all know, these are high signs of stones beginning to form or already present in the urinary system. The CT scan uh, showed hypercalciuria in the urinary bladder, and I also saw a cystolith present as well. The next step was to have a cystoscopy done. This would give me a better picture and to follow up on the diagnosis I had previously given. I had my patient scheduled to have the procedure done the following day. After viewing them, there were stones present that I could clearly see. We then began to talk about treatment. I explained to my patient that the stones were quite large and too big to pass on their own. I told her that a cystolithopaxy would be the best move. That way I could break down the stones and have them removed. After a successful procedure, I prescribed my patient with some pain meds for her discomfort following the procedure. Also, I suggested that she drink at least 8 glasses of water a day. We also scheduled a follow-up a month from when the procedure was done. I would later do a CT scan just to check to see if all the stones were removed and if any more had formed since then. She came for her follow-up and everything looked good, and she explained that she was feeling much better. My recommendations for health education strategies that could help prevent the health issue is mostly watch what you eat and drink plenty of water. These are my top two choices because when a patient comes into my office with either kidney or bladder stones, they don't have the best diet and they don't drink enough water as well. If you if you've had calcium oxalate stones like my patient did, you may want to avoid these foods to help reduce the amount of oxalate in your urine. Nuts and nut products, peanuts, which are high in oxalate, and spinach, just to name a few. A patient can also ask what type of stones they've had. That way, if they're eating too much of that food, it can help reduce the chances of getting that type of stone again. Patients can also look these things up so that they can have a better understanding of what is causing the stone. Further research can be done to help with this issue is to consider exactly why certain foods you eat cause the stones to form. Also, how these stones over time can damage your bladder and kidneys. Another research recommendation would be to look into where the formation of the stones begin. With these ideas, we can have a better understanding of this disorder. It is important that our healthcare professionals give their patients as much info as they can when they come in with kidney or bladder stones. A suggestion would be to have pamphlets on the disorder, and this would give patients basic info on the topic. There can be tips and tools in the pamphlets on how they can eat better and and also what they can do to help better themselves, as well as drinking plenty of water. Sometimes healthcare providers get into the pattern of diagnosing and treating patients, but not really giving them more info on what they're being treated with. Normally, it's just basic information we give, but there could be more out there that can help inform our patients. Thank you.